that we've been on, folks. I'm happy to see so many of you here. My sense, I didn't get to listen in, but my sense is that Trevor provided the most brilliant segue into this closing session that I could probably imagine. So thank you, Trevor, for that. We didn't plan it, but I know Trevor well enough that I know that was his direction. And so this is sort of the final phase of this learning journey that we've been on. And as Away Home Canada, we want to walk you through some of these final steps of the policy process that we want to be engaged on with you. And before I do that, I'll share my screen. But for those of you who aren't aware and haven't been in our sessions up to this point, Away Home Canada is a national coalition that is working towards reimagining solutions to youth homelessness through policy, practice, planning, and innovation. And we've been really grateful to have partnered with ASI on this conference and have learned a great deal over the last 2 days, which I'm sure you have as well. But our work isn't done. And so this is an opportunity for us to take that next step. The next step in pushing real policy momentum around mental health and mental health promotion for our Atlantic provinces. And so as we kind of lead into the closing and lead into this conversation with yourselves, pardon me, we will take you through sort of the final 3 steps.
David, you've gone up to the top. I've got the bottom.
All right, there we are.
Oh, there, yeah.
So in the next 30 minutes, we'll go through some things. We're going to talk about some of the themes that we've learned from ASI over the last 2.5 days. I'll talk about a policy brief, which has been alluded to a number of times, and what we're hoping to gain from a policy brief, some of the next steps necessary, and then we're going to open it up to Q&A. Keeping our time limited, of course, but we want to be sure that we've heard you and there's an opportunity for you to have some dialogue with us and maybe ask some questions and some clarification around the next steps. And so what we're hearing, and across the sessions, we've heard a number of really important sort of starting points for the conversation. The reason why I say starting points is that not only are we building this understanding and these policy moments for sort of the wrapping up of ASI with yourselves, we're taking the content that we've learned and just been generated over the sessions over the last 2.5 days, but we're also going to be taking the step towards working with yourselves following the Institute around, building out what these themes should look like. And so what we've heard thus far is that, and maybe this is no surprise, but that there needs to be federal, territorial, provincial, and municipal leadership and integration and collaboration on the issue of mental health promotion and mental health supports, and that municipalities are really well positioned to be able to lead this work and again, read the community and get a temperature read from stakeholders to better understand the priorities of the community level. And so we need to be conscious of that. As with everything, there needs to be a layer and an emphasis and a priority on child and youth voice within this work going forward. We can't do this without them. And we know that as leaders and as influencers in our communities, we've got a position to play with ensuring that young people are heard and have a voice within change that affects them. And so this needs to be a priority for us. We also heard loud and clear that focus on equity, diversity, decolonizing institutions needs to be a priority for us, and how we think about these next steps within mental health and mental health promotion, and that we can't lose sight of the opportunity that the COVID-19 pandemic has given us, in that with crisis comes large-scale change. And we've seen that there have been more collaborative and more integrated efforts happening because of COVID-19, and we don't want to lose that momentum. And we need to think about how we continue to work differently to support those who are most vulnerable. What we've also heard loud and clear is that there needs to be a continued focus on community innovation. I firmly believe that the solutions to these issues lie at the community level. And it's important for us to be able to cultivate and share those stories that translate into policy permission for all levels of government. I'm a firm believer in that if we aren't asking the questions of community, we aren't getting the really solid answers. And so we need to continue to ask questions of community about what's working, what's not working, and where are the gaps. And we will continue to do that as we move into these next phases of the work. And so what is a policy brief and what do we hope to get from it? So the policy brief that will be a result of all this work and where we land with some real priorities is an opportunity for us to push in front of Atlantic premiers and the federal government where the integrated thinking and the priorities lie for community participants across Atlantic provinces for continued mental health promotion and mental health supports. And so given your sheer numbers, given the focus on supports of keeping people in your communities, we want to hear your voices come through loud and clear in a policy brief that is clear, crisp, and focuses on new investments, but also policy change or policy shifts that needs to happen to ensure that we can achieve and we can maximize the potential of mental health and mental health promotion. And so over the next month, I would say, we're going to be gaining insight from yourselves based on the roundtable content we pulled yesterday, based on the additional content that you will build out in the questions that we've developed for yourselves, and in the evaluation components that exist. So you'll be completing an evaluation at the end of all this. There are some moments in there where there are fillable fields for you to identify where you feel the policy priorities are and where the call to action from ASI has really resonated for you. And that then will drive towards what we feel are the priorities moving forward. Your work isn't done from there. We are opening up this policy brief development process to anyone who wants to be involved. So that could include young people, that could include participants, program practitioners, policymakers, researchers, anybody who is interested in helping us develop this policy brief. We want this to be a co-developed process. And we want to make sure that you're heard in this process. And so there'll be constant steps of validation in this policy brief. And so I don't want to say the policy brief will be a certain length because I don't know. I don't want to say the policy brief will contain certain priorities because I don't know yet. But what we want to do is support that process and ensure that you have a lens towards what your community needs. You are the best temperature read on the needs of your communities and your stakeholders and your organization. So we will default to you and take your leadership on how this policy brief takes its shape. We would rely on the ASI team to then move the policy brief to Atlantic premiers and the federal government and then hold them accountable for a response. And so again, we hope to, with yourselves, work on that over the month of September to then hopefully have priorities identified for October, which would then get us into a nice place for budgets and prioritization of not only new policy efforts, but funds possibly. So I guess before jumping into that, I've talked about the next steps. So there will be this open dialogue moment for us right away. There will be the open doc that's been shared out by Julia, which I really encourage you to provide feedback on, which will be the starting place for the policy brief. And then there will be the evaluation component, which we will take signals from as well. And so these are sort of the early phases, but then we also will look to yourselves around perhaps innovative ways to think about moving this forward. And again, we don't have all the solutions, and so we look to this to be another co-developed process with you to design what this means for moving forward together. So I'll stop sharing my screen. That's the real Coles notes of where we're going from here. And now I'd like to open it up for the next 15 minutes to feedback, discussion. The Whova chat is available. So I encourage you to place your comments in there if you have questions or concerns or specific things you want to voice and turn your microphone off on. But this is your opportunity now to maybe ask for clarification or maybe identify some priorities for yourself. So either unmute or fill the chat line.
I have a question. It's Samantha. So my idea was already that we have a federal mental health minister, and then have a complementary one in each province.
Mm-hmm.
I'm wondering, is that kind of skipping to the very end?
No, I think that's a great priority. I think, I think that ensuring that there's a representation across a policy portfolio with a minister who's made accountable for those kinds of things, I think is excellent. We've seen that in other spaces, and given the mental health portfolio is so broad, I think that also helps support sort of the degree of involvement across government. This isn't a one government issue. But having somebody responsible for holding it, whether it's a minister or a secretariat or whatever it looks like, I think that's a great idea.
David, I'm just wondering if people could, if they're not going to write, if they could raise their hands so that we get a chance to know who else might have questions in the room.
Yeah, great idea. Malcolm, go ahead.
Yes, we've just building a bit on the previous comment and what I heard, what I've been hearing for the last 2 days. One thing I think we could be proposing to governments at really all levels, when I'm thinking provincial governments in the Atlantic region, is that they pull together a mental health and well-being fund with contributions from all departments and with staff secondment from each department to work collaboratively as a team, and that this fund would be made available to support integrated community work on the ground level. For example, we heard about what's going on in Eskasoni with a whole community coming together to do things, and the Raising the Village is another one in Inverness County. So at the provincial level, to pool resources and people to fund and support and community level integrated community responses. Seems to me that would be something we should be including.
Yep. We've seen examples of where governments have been able to harmonize funding and co-fund opportunities, but also harmonize outcomes, which I think is an important step as well in thinking about how to then influence one government approach to certain specific social issues. So I love that. Trevor.
As was mentioned in the introduction, I've worked most of my life in the area of healthy communities and sustainable communities, and I think municipal government is absolutely central to this, and frankly change comes from the bottom, not from the top. So I'm not holding my breath on getting federal provincial governments to shift their ways, but there's huge potential at local government. We heard a wonderful presentation from Mayor Arnold from Moncton the other day. There are lots more inspirational municipal leaders out there like that. And the other thing is, we've got only 12 provincial or 10 provincial and 3 territorial governments. We have 3,500 municipal governments. The potential for experimentation and innovation is much greater. So I would strongly urge people to put a lot of focus on getting change at the municipal level. And for that matter, run for council, get on council. That's the best way. Much easier to do than running for federal or provincial parliaments.
Great. Yeah, great points, Trevor. Thank you. Samantha.
Well, I guess I kind of am seeing that it's not an either or, respectfully. I would just say right now, I think writ large, the Canadian public has a lack of trust in public services and the government and how mental health is being addressed. So I really strongly feel that the suggestion I made would be a huge step of restoring people's trust and confidence that mental health is being addressed seriously and now.
Mm-hmm. Yeah, agreed.
I'll just jump in. It's Jim Mustard here.
Yeah, thanks, Jim.
And I appreciate what Samantha's saying. It's not an either or, and I also appreciate what Trevor says. So I think there's two things that can happen here from a municipal standpoint and a provincial standpoint, is we can strengthen that sort of more collaborative model at the provincial level where many of our programs come from. But we really do establish a more educated municipal governance level about what upstream looks like, what are some modeling that we can do, and how can we support those pilots by being given policies that really do look at what are the data sets, what's the anecdotal evidence, and where are we trying to get to. So I think we can speak to policymakers in that language. In our community, we just want to talk about places to connect and belong, not just, but really essentially establishing a more poetic vision of what a welcoming community might feel like from our infants to our elders, especially during this COVID and coming out of it. How do we create those social spaces that really do deserve to now be better coordinated and more available? So I think I'm on both levels, but I think what we can do, going to Trevor's point, is really get into the mix this fall in Nova Scotia and certainly look at putting names forward, but also platforms forward that really establish the importance of upstream mental health, a more collaborative approach from our provinces. And let's look at some pilots that we can invest in to get some data sets that really give us some strength to move forward.
Yeah, thanks, Jim. Christine? Love that. We've seen that, resonate across a number of different fields around equitable access. I think that's an important thing to highlight. On the other hand, CFCN.
Hi, I'm Louise Leonardi.
Hi.
I'm the Executive Director. It's Canadian Families and Corrections Network, in case you're wondering. So I was just wondering, thinking about, when you want government to do something, it's really good to have support from communities and people behind pushing government to say, yes, we all want this too. And I think we're starting to see people push in that direction in terms of COVID and mental health. And they're trying to tell the government that, yes, you're putting the money in the right thing. We need to live. We need to be well. And so can we use that, and can we maybe perhaps create some kind of a media campaign around children and youth and mental health that will capitalize on that, but also just keep it running going forward? And I don't know if this is something that ASI has access to or others, that we could make like a video media campaign that kind of gets community support and the support of ordinary citizens to say, yes, we want government to start looking at our well-being. So when the policies and the policymakers started talking about it, people are already on board.
Yeah, I love that. And I think, I had the privilege of facilitating a session yesterday, and Sean Casey was in my room, and he had words for us that really resonated for me. And I paraphrase, and he spoke to the reality that in pre-COVID, there was a focus on balancing budgets and economic growth. But now there is a focus, and there really is a concentrated focus around how do we build back better.
Yeah.
And that there is recognition that economies and lives can't collapse. Yeah. And so how do we then use that as the frame for overall well-being, and those being priorities for us moving forward? So I love that idea.
Yeah, like the impetus just to push us forward in a great direction. Yeah. Thanks.
Yeah. Samantha, did you have another question, or was your from the previous one? Because if not, we'll move to.
Sorry, I have more than a million questions, so I don't have time for that many. But I'm just trying to think of what the other one is. Oh, and I think I liked the talk of the immediate ground level funds. I don't think that idea should be underemphasized. Like that is definitely important. Like not only at that federal level, but like what is being said, like we need to get money to the municipalities and the ground level places helping the people now. Correct. So I guess I just want to emphasize that I that sounds amazing, but how, please expand on what we're talking about, a mental health and well-being fund, and like how would that happen and work?
You want us to expand on that right now?
Or
I
anytime.
certainly don't have the answers right now. I think that's something we need to figure out together. And I'm looking at the rest of the chat line. There's more questions. So you'll have to wait on those realities, Samantha. We'll work on those with you. Selvi, Christmas, and Sophie. So Selvi first.
Thank you, David.
Yeah.
My point just echoes a couple of points we've heard already, but just want to give it some, just to forward it again here about having sort of a council or a secretariat, if we may call it, a coming together of different ministries at the provincial level, supported by the federal level, of course. Something like the interministerial secretariat for women that we have, an interministerial secretariat for well-being, truly telling everybody that it is an interconnected concern and everyone's got to work together, and see that percolated as possibly even at the school level to have folks, we have counselors, and they're all well trained, some less, some more. Perhaps we could include well-being training in the PD for our teachers, for our counselors, and have that at the youth councils as well. We try to promote youth parliament. We want civic engagement. We'd like to have youth involved, adults involved as well in enhancing well-being at the community level, are my thoughts.
Love it. Love it. Melissa.
Hi there. I just wanted to acknowledge two-eyed seeing. I think in order to encourage two-eyed seeing, we need more Indigenous leadership programs, not only in the individual reservations, but also like across Canada, if that makes sense.
Mm-hmm.
But yeah. In order to do that, we would need to take a lot of baby steps.
Yeah, I hear you on the baby steps, but I love that recommendation. Thank you, Lisa. And I see we're approaching our time. So Sophie, you're going to wrap us up. It's a great closing comment. And I think that the idea around harmonized data sets and the importance of leveraging good data in this work is going to be at the foundation of our success. So you all have to move on to the closing. I want to thank you on behalf of Away Home Canada. I want to thank you for your participation and your commitment to this. Reach out to us if you're interested in sharing in the policy brief. Fill out, don't be shy. Please don't be shy in the open doc, and fill out the evaluation. Take care of yourselves. Bye-bye.
Thank you.
Thanks, everyone.
Oh, we're not done yet. But thank you very much, David and Mary Jane, for all the work that you've put into this, and a big thank you to Away Home Canada for being such a great partner. I know we're still working together, and that all of you have been invited to work with us and with David and Mary Jane in putting together this policy brief. We've lots to build on from the last couple of days, from two-eyed seeing, thinking about new perspectives, different perspectives, Indigenous ways of thinking, to the evidence that we have about the importance of brain development and the message about developing mental health promotion strategies that reflect the developmental needs of kids along the life cycle, and including the parents and the caregivers. So lots to think about, and we just really want to engage all of you going forward